Hello students, we will discuss on-table operative finding today. Just see what this operative procedure is. See that? You can see here, which is hooked up, ear lobule. You can see incision here. Skin hooks are raised here above. I can see here some small branches here. See that? Some glandular structures here. So what is this operative finding procedure is? It is right-sided superficial parotidectomy, also called as PT's operation. It is done for benign parotid tumors involving the superficial lobe, maybe pleomorphic adenoma, which is the commonest type. Then Warthin's tumor, common in males, commonly bilateral, common in smokers, and so on. And what are the findings and indications? What incision is placed? So what is the name of the incision? So facial nerve branches are seen here. See that? Here, facial nerve branches are seen here. Main trunk is here. Superficial upper part, temporofacial, lower part, cervicofacial, and temporal zygomatic, upper buccal, lower buccal, marginal mandible. All these branches are very, very important. They are motor actually. And so you should know how to identify facial nerve on table. Tragal pointer, Coonley's tragal pointer, then styloid process, tonnocardium muscle, digastric muscle, and of course in the deeper plane, once you identify that nerve, facial nerve, and you will be able to identify the retromental vein also. That is called faciovenous plane of PT. So superficial parotidectomy operation is PT's operation. Another PT's operation is modified radical mastectomy in the breast surgery, MRM. Where this is another PT's operation, superficial parotidectomy, and faciovenous plane of PT is the plane where superficial and deep lobes are segregated. Deep to that is deep lobe, only 20%. Main component of parotid is in the superficial lobe, that is 80%. So lazy S incision, there is a one which is used here. Remember, there is MCQ question: Sistrunx incision or modified Blair's incision or lazy S, like this lazy S incision. That is incision we pass, and indications are parotid tumors involving superficial lobe. Benign, important. Usually malignancy will do either radical parotidectomy or conservative parotidectomy, total conservative parotidectomy removing the fourth superficial and deep lobe. Entire parotid, including superficial and deep lobe, should be removed if it is malignancy. In benign, only this one. If deep lobe is involved, even benign disease, you have to remove superficial lobe, then you have to remove the deep lobe. So any deep lobe disease, whether benign or malignant, treatment minimum is total conservative parotidectomy. Benign deep lobe tumor, treatment is total conservative parotidectomy. Benign superficial lobe tumor in parotid, treatment is superficial parotidectomy. Malignant tumor, either total conservative parotidectomy or many situations may not be able to sacrifice the facial nerve. The entire thing has to be removed with the lymph node, that is called radical parotidectomy. And of course, you put a graft for the facial nerve, cut facial nerve through different nerves, maybe greater auricular nerve graft or from the nerves from the lower limb or upper limb you can take, which is suitable. So to take, that is how exactly we will go ahead with the parotidectomy. So you should know the complications also. So remember all these things: features of facial nerve palsy, salivary neoplasms, exams salivary neoplasm, auriculotemporal nerve syndrome, Fraze syndrome, different types of parotidectomies. I am not going to detail that. Answer the MCQ. 45-year-old female patient present with the slowly progressive swelling in parotid region with the curtain sign positive. Remember, what is it? On oral cavity examination, ipsilateral tonsil was pushed towards the opposite side. Ideal surgery here is superficial parotidectomy, functional parotidectomy, total conservative parotidectomy, suprafacial extracapsular parotidectomy. So students, write the answer in the comment box. Tomorrow I will tell the right answer. So please go through my clinical methods in surgery, manual of surgery details everything about salivary gland and different surgical techniques of salivary glands procedures. My operative surgery book, and of course my DigiNow lectures through JP Publishers gives everything about surgical aspect for undergraduates and basic for the PGs through JP Publishers. So please subscribe, purchase for a year, and you will have the better knowledge for the surgery as such before facing the exam as such. So students, I hope you understood this lecture very well. Thank you very much.